The technology you've given us today with something so small, portable, inexpensive is remarkable. Hi, my name is Alan Hirahara. I'm an orthopedic surgeon specialized in shoulder and knee arthroscopy and sports medicine, in ultrasound and orthobiologics. I work in private practice in Sacramento, California. I do a lot of research, speaking, teaching, publishing, and ultrasound is an interest of mine because it helps me really treat my patients better. It's a way to do things to be more reliable. So for example, when I do an MPFL repair, I can know that I am anatomically on the spot I want to be at, putting my anchor exactly where I want to be. Frankly, doing it open with a finger trying to find the spot is darn near impossible. It's actually very difficult to do. Even doing it with the current use of fluoroscopy is very challenging and has a high chance of missing. Doing things like your pars Achilles, well, gosh, I'm sorry, there is nothing else you can use to do that job unless you open it up fully, but then it's no longer percutaneous in surgery. This technology allows us to treat patients better with more options, more precision, and in the end, it's going to be better outcomes. Obviously, I started off having the classic clamshell, laptop, large, ultrasound machine, which then went to the large, office-based clinic machine. And of course, I used to carry those laptop clamshell scanners with me in a big bag and take them with me to games, have them on the sidelines. Now that I have a portable scanner that literally goes in my bag, that's like so light, it's smaller than my iPhone, it now is revolutionary for me. And so, for example, my children, they do Kung Fu, they do martial arts. So if they happen to get injured, I'm right there. I just whip the scanner out, pull on my iPad, and within 13 seconds, which it takes to turn on, I'm scanning them. It takes nothing. When I do an injection and I pull out my ultrasound and they can see what I'm looking at, and I'll show them, here's the spot I need to go to. This is your problem. Then they see the needle come in the screen and get to exactly the spot I just pointed to. They're like, oh, wow, yeah, I just saw it. And it kind of blows them away. And then of course, since I'm able to be so point specific, and I'll tell them flat out ahead of time, look, this is gonna go in your joint, this is gonna go in your subacromial space. And of course, I hear the same thing from every single patient. Oh, no, I've had these shots, it hurts like hell, it's gonna be really bad, it's gonna be horrible. I said, no, it's not gonna be bad. And then when it doesn't, they're like, well, why didn't the other guy do that? They're blown away by the fact that, number one, I can put it where I say I'm gonna put it. Number two, it's actually faster and more efficient. They're in and out because I'm not digging and trying to guess. And three, they have such a high clinical outcome and they're so satisfied that they're convinced. I am seeing a slow change over time now that's starting to be taught in residencies, a change in people's attitude and perceptions that yes, this is simply a technology which is necessary for us to use to help patients improve better, get better diagnosis and better treatment. I think what's going to make a difference is not the ease, not the technology, it's the price. Your ability to give us less expensive technology is what's truly going to make the difference and convince people to give it a try. Because the reality is that's what it's going to take, actually just doing it. Once you do it, once you see the utility, it's obvious what it's going to do for you. That's a really great question. In 2009, I was in front of a whole engineering department CEO of a big ultrasound company. And I stood up in front of them and I held up a transducer that's just about this size. And I held up my phone, which was actually bigger than this, and said, this is what I want. This with this. This size, no cord, this. And here I am, literally 13 years later, and I've got it. I think Clarius, what it's really done, has revolutionized smaller and wireless. That is really where it's at. Sure, there are other wireless ones and pseudo-wireless ones and handheld small units. Nothing that I have seen has come close to the quality of the image of this machine. Sure, some of the other ones are cheaper. You get what you pay for. At this point, what I like is the innovation. I like the continued push for smaller, for optimization for our usage, for improved resolution, for improved technology. I think what I see in this company is that push to really do something that needed to be done 15 years ago, which at the time, by the way, in that meeting, everyone laughed at me. And they told me flat out it was impossible. So here we are, years later, with a much smaller company that made that big company eat their words.